How can raw patients recognize a real disease flare? Imagine waking up and feeling that your joints suddenly ache more than usual, or maybe your fingers and toes look swollen and feel tender. That's often how a rheumatoid arthritis flare begins. A real flare usually shows a noticeable increase in joint pain, swelling, and stiffness that lasts longer than your typical symptoms. You might notice warmth or redness around the affected joints, especially in the small joints of the hands and feet, but larger joints like the knees or shoulders can also be involved. During a flare, joint stiffness can last more than 30 minutes, especially after resting or in the morning, and it might stay throughout the day if the flare is severe. Besides joint symptoms, you might feel more tired than usual or develop a low-grade fever. Some people notice feeling generally unwell or even a bit down or depressed during a flare. These symptoms can make daily activities like dressing, cooking, or even driving more difficult. It's important to recognize that a flare isn't just a little discomfort. It's a period of increased inflammation that goes beyond your normal symptoms. Pay attention to changes in how often and how intensely your symptoms occur. If your pain and swelling become worse or last longer than usual, or if you notice more frequent flare-ups, these are signs your disease activity is increasing. If your usual methods of pain relief stop working, or if your morning stiffness lasts longer than an hour, it might mean you are experiencing a flare or your disease is progressing. Since rheumatoid arthritis symptoms can differ from person to person and change over time, keeping track of your symptoms is very helpful. Using a symptom diary or app can help you notice patterns and communicate effectively with your healthcare team. Developing a flare action plan with your doctor can guide you on how to respond quickly, whether that means adjusting medications or modifying your daily activities to prevent joint damage. Recognizing a real flare involves noticing a significant increase in joint pain, swelling, and stiffness, often accompanied by systemic signs like fatigue and mood changes. These symptoms can interfere with your daily life and should prompt you to seek medical advice promptly. Remember, every person's experience is unique, so working closely with your healthcare provider is key to managing flares effectively and maintaining your quality of life.